In a merry month of June, from me home I started, left the girls at June, nearly broken-hearted, saluted father dear, kiss me darling mother, drank a pint of beer, me grief and tears to smother, then after eat the corn, leave where I was born, cut a stout black thorn to banish ghosts and goblins, a brand new pair of brogues, rattling o'er the bogs, frightening all the dogs, on the rocky road to Dublin, 1, 2, 3, 4, 5, hut the hare and turn her down the rocky road, all the way to Dublin, whack for Lolly-Rah. In Mullingar that night I rested, limbs so weary, started by daylight, me spirits bright, and Mary took a drop of the pure, keep me heart from sinking, that's the paddy's cure, whenever he's on for drinking, to see the lassie smile, spirits bright, and Mary took a drop of the pure, keep me heart
God
from sinking,
ettermiddag
that's the
alle sammen. Der fløtte sa dere alle. Takk for at du kom. Jeg heter Emre, jeg kommer fra Tyrkia. My main supervisor is Mikko Molyanen. My co-supervisors are Samelin and Inga. They're from Harstad. It's me. And, oh, but no worries, I'm not gonna escape. Today, first of all, I would like to introduce myself to you. Then I'm going to talk about my project background and its objectives. Who am I? Shortly, I graduated from business administration in 2012, and in the beginning of 2018, I finished my master in financial economics. In November, I came to Norway directly from Turkey, and I started my Ph.D. in economics, and also currently I am a board chair of Ph.D. and postdocs at UIT. And the project background. My project topic is social inequalities in health. In this project, I am in a collaboration with 3 different PhD fellows and with their supervisors as well, from politics, public health, and history department. And today, in the morning, we'll learn from 21st century's 21st century skills, yes. 21st century skills, collaboration, communication and problem solving. Thanks to my colleagues in this project, we are trying to solve the problems on the process, and we have really good communication and collaboration. And our project group is sub-project of population studies in the north, and this project is UIT's interdisciplinary strategic project. And we have 130 million kroner internal funding, and hopefully we will get also external funding in future. In my project, Tromsø Study and Historical Population Register data are main data sets, and we are planning to link 2 different data sets that we are hoping to have one panel data, and then we can analyze intergenerational health behavior. And what is Tromsø Study? Maybe someone might not know this study. It started in 1974. The main reason why they start to make this kind of study, because in those years in Tromsø, they would like to understand why they have high mortality of cardiovascular diseases. But after the third study, they start to ask pretty much every questions about your health or mental health, psychological, mental health, skin disease, stomach, and other kinds of health things. And this study is unique in their field because, for example, we have more than 18,000 participants, more than they are participating on 3 or more studies. The Historical Population Register, it started from 1801 to 1964. It's built by linking transcribed version of the census, church, and vital registers. Someone's sleeping now? Is everyone like this now? Okay, cool. What is health inequality? According to Kawachi, health inequality is the generic term used to designate differences, variations, and disparities in the health achievements of individuals and groups. And according to Jean-Jacques Rousseau, there is two different inequalities. One is based on your nature and physics, and the second one is established or at least authorized by consent of men. But today, we are talking about 7 different types of health inequalities. And I'm mostly interested in social mobility in health. And why economists are interested in health inequalities. It's known that health is one of the main determinants of well-being, and it helps to measure quality of human capital. Just imagine that you are feeling sick and you're at work now. Can you produce 100%? Can you feel that, okay, today I'm productive and I can do everything? No. And that's why health and daily health, it's really important as an economic resource. And according to growth theory, there is a correlation between initial health status and subsequent economic growth. And in the long run, health inequality means the waste of public investment. So, in a summary, health is directly related to human capital. Oh, sorry. That's why, as an economist, I am interested in health inequalities. And I have 2 research questions. One is what is the effect of childhood socioeconomic status on an individual's health behavior? With these questions, I am planning to understand underlying mechanisms of how childhood socioeconomic status can affect individuals' current health, and also the reproduction of the health inequalities. The second question is, what is the impact of the socioeconomic status of the individuals on health behavior? And with the second question, I would like to understand your current socioeconomic status and current health behavior. And in the current literature, those 2 questions asked many times, and we have lots of articles. But our difference is, with our panel data set, we will have a chance to compare your childhood socioeconomic status and your current socioeconomic status. And then we can say that which one is much more important. And after that, we can maybe find some early intervention methodologies for public health services. And as I told you, I would like to have in near future panel data. And here will be my historical population register data. And then we will link it with Tromsø Study, from first wave to 7th wave. Those are my preliminary variable lists. As a dependent variable, we are planning to use one of them, BMI or exercise, smoking or excessive alcohol habits. And in this process, also we are planning to use one of the discrete choice models. So, what happens now? What I'm doing currently? Currently I am in the process of application to NSD and REC for ethical considerations. And also I will apply to Tromsø Study for the dataset. Tusen takk.
He's pure whenever he's on for drinking. To see the lassie smile, laughing all the while at me curious style to set your heart a pulling and ask if I was hard. Wages I required till I was nearly tired of the rocky road to Dublin. 1, 2, 3, 4, 5. Hut the hair and turn her down the rocky road all the way to Dublin. Whack for lolly in Dublin next arrived, I thought it such a pity to be so soon deprived of view of that fine city. Well then I took a stroll, all among the quality bundle it was stole, all in a neat locality. Something crossed me mind, when I looked behind, no bundle could I find. Upon me sick a woman inquiring for the road, said me Connacht Road wasn't much in vogue on the rocky road to Dublin. 1, 2, 3, 4,